can pandemic have positive impacts on cities? We have learned a lot from previous pandemics. We have learned how to respond when the outbreak. We have created innovations to face the new situation. We have adapted our cities and master plan. And we understand better the societal impacts that they produce. Let's take some examples. In terms of responses, we created government health boards to provide advice on the public health response. We imposed quarantine of people and goods to identify any infectious disease. We forbade public gathering to limit any propagation. And we also noticed in the past that states strengthened their power over individual lives in those period of pandemics. Does this for initial response ring a bell during this COVID-19? Because actually, we have been living the same in this crisis. But do you know when these responses were invented? They were invented 600 years ago during the Black Death. So it's interesting to notice that the measures we had during our medieval time, we are actually following the same today. Also, over the centuries, escape communities were created where no one came in and no one went out. It was noticed during the Spanish flu in 1918 that this concept was quite efficient. And in the 19th century, we invented a global monitoring system of outbreaks where each country in the world would communicate of any outbreaks when they have one. Previous pandemics also have boosted innovations to respond to the new situation. After some pandemics, we observe that there is a shortage of labor. Like after Black Death, when 60% of Europe disappeared, there was a huge shortage of labor. And today, during COVID-19, countries in the Middle East or in Asia, they are actually asking for more workers to continue to develop the country. So this shortage of people actually boosted the others to innovate. Like they did some mechanical innovations like windmills, water mills, and more recently, all these digital innovations with all these apps that we have. Medical innovations were also created with antibiotics and vaccines. The vaccine for the smallpox in the 19th century was the first one. We also innovated in our urban infrastructures. The sewage system was reinvented after the Great Stink in London in 1858. The clean water system was also reinvented after an outbreak of cholera in the 19th century in the UK, in London, where we added sand filters and chlorine to purify the water so it could be drinkable. Also, the water drainage was reinvented in agriculture because we needed to get rid of this stagnant water, and we replaced stagnant water by a continuous flow of water. In cities, we also adapted them to better live during pandemic situation. For centuries, we had this miasma theory. If the air smells bad, that means there is an infectious disease. So cities adapted their design and their urban plan with parks, and in order to create an area, a zone where we could have clean air, where people could breathe. We also developed large streets to improve social distancing. Reforms in housing were also imposed in order to fight against crowded areas, living places. We get rid of all stagnant water in cities. And an interesting thing was that the value of the meter squared did rise on top of the hills because some villas and the upper class society actually started to build their villas on top of the hills in order to have a clean air. We also have learned a lot about the impacts of pandemics in our society. We have learned that it is important in those times of crisis that we need to communicate with the people and we need to increase their awareness about what's going on. Why are we having these type of measures? They need to understand that because it is a time where our civic capital is actually challenged. Because with all these measures which are against our will, we understand that actually the government understands that there is a level of social acceptance. Like, for example, in India in the 18th century, when there were an outbreak of cholera, the British, it was a British colony, so the British army was burning houses where the Indians were living when they were suspecting any cases of cholera. And then they were separating the women and the men should they are suspected of being infected. And these measures actually were not understood from the locals, Indians, and they responded with violence. They totally disagree with that. And we are observing this violence even in Europe, in Germany, in France, and in the States. People, they have a level of social acceptance because these pandemics are creating psychological traumas. And in this time, there are some myths and conspiracy theories which are emerging. During this COVID-19, have you heard of any conspiracy theories? So people are living, the society is living with stress, with the fear of being infected. There is this frustration of freedom and boredom to stay in quarantine. In fact, these changes have created the ground for larger and more livable cities and prosperous cities. Thanks to those pandemics, we have been able to accommodate, to transform our medieval cities into livable cities. Because you have to remember that during our medieval cities, until the 19th century, cities were not very large. We were 10,000 to 100,000 people, rarely above 200,000. Because the disease were self-regulating the population inside cities. Cities were actually death traps. It was difficult to survive in cities. And by cleaning them, by adapting these cities to live in times of epidemics and pandemics, we have now created the ground for livable cities. And we are happy that only since 1960, we can accommodate more than 1 billion people living in cities. And today, in 2020, we are 4 billion people living in cities. So today, pretty much worldwide, the urban life expectancy is higher than the rural life expectancy, which is a complete reverse from 200 years ago. But the combination of larger concentrations of people in cities, much larger concentrations of animals on factory farms, the global warming and the continued rise of global travel, as well as the range of recent outbreaks, suggest that we should be prepared for a future pandemic.